welcome and thank you for joining us. These are the interviews we do for the Department of Ophthalmology at the University of Pittsburgh. And today we are interviewing Dr. Ellen Butts. Dr. Ellen Butts is a clinical assistant professor of ophthalmology at the University of Pittsburgh School of Medicine, and she's the director of optometry services. Dr. Butts, good to see you again, and nice to be able to sit down and do this with you.
It's a pleasure to be here. Thanks for having me.
So we've met a few times, and of course, you've done some of the webinars for the Eye and Ear Foundation, but I guess I haven't even for myself gotten to know some of the things that really got you excited about getting into science and medicine in the first place. You're doing a lot of things for the department, including some of the education, which we can talk about. But what was your path to get to where you wanted to work as an optometrist and taking on some of these challenges related to people and their struggles with vision loss?
Well, this is always a fun question for me to answer because I knew at a very young age that I wanted to be in the eye care field. Around age 12, I had a Reader's Digest article that was at my grandparents' house in Canada. I spent all my summers there. And one of the front pages talked about the eye, and it showed a fundus photo of the optic nerve, of the blood vessels, and showed how, as eye doctors, we can look inside the body without imaging like MRIs or CT scans, but we can actually watch blood flow. We can see a nerve, see a disc head. It's amazing what we can see looking into the eye. And how that correlates to systemic health, being able to pick up on, an early chances that a patient might have a stroke or hypertension or diabetes, and how it all ties together, and how the old saying, the eye is the window to the soul. It really is. In eye care, we're able to see things that might save a life early on. And oftentimes, as a primary care eye doctor, I'm the only doctor that patients are seeing. They don't even go to their primary care physician. So I'm able to prompt them, by seeing something as simple as loose eyelids and say, hey, do you struggle with sleeping? Do you wake up feeling not rested? Maybe you should get checked for sleep apnea because it correlates. We just are in such a unique position to take care of our patients. And really just that passion started at a young age, seeing that article. And then in high school, I went to high school in Hopewell, so pretty close to here. We had a senior project we had to do, and one of the paths was looking at what future career you wanted to go forth and what you wanted to do with your life. And I chose eye care. So I shadowed optometrists and ophthalmologists, and I learned to refract or check for glasses prescriptions when I was 16. I had a really fantastic mentor who took the time to teach me, basic refraction, not what I can do now, but that was just, my passion grew, and I realized that I preferred clinical-based medicine versus operating room. And when I was in optometry school, I realized how passionate I was about hospital-based care and the access that patients had by being in a larger institution. And then in residency, I did my residency at Bascom Palmer in Miami. And that's where I realized that glaucoma was my true passion. And that's why I spend time collaborating with the glaucoma clinic. My mentor here is Dr. Ian Connor, the director of the glaucoma department. And working with him gives me a unique opportunity as an optometrist. I am able to practice medical glaucoma. And then if my patients ever need surgical care, he just walks right in the room. We get them prepped for a surgical procedure if it's an in-office procedure. And then we're able to maintain continuity of care because he does the procedure right in office. And then I bring the patient back. I make sure that everything went okay. And then I see them, whatever the indication is the time afterwards. And then we're able to just continue that care in a way that is really patient-centered. So it's not waiting 4 months to see a surgeon for a procedure that could have been done on the same day that you saw me. It's getting everything done. It's taking care of their sight. And it's a beautiful thing to be able to work in that department. Glaucoma, for me, the passion is because I can sit there and teach patients. Glaucoma, it's potentially blinding, but it's a silent disease in most cases. Most patients know the word glaucoma, but they don't even realize that there's several types of glaucoma, and I have photographs I can show patients, I can teach them. So it kind of just dives into my passion for teaching as well, which is why I kind of took a liking to glaucoma in residency.
That's fantastic. I'm actually really pleased to hear myself related to the continuum of care, because you have an opportunity to be at the front lines when someone's maybe comes, as you said, doesn't know they have glaucoma because it's a silent condition. You can, one, be someone who helps them understand that this is really important for them to get the follow-up and get the care they need so they can save their vision. And then you could be with them afterwards, after they've maybe had surgery or other treatments to their eyes, and follow them and continue with care and helping them see with everything that they may need, including, I guess, contact lenses or whatever it may be, right? Or prescription glasses. So fantastic. And it's really exciting to hear about all of that sort of coming together with, and you coming here with all of the background and sort of drive that you had to learn all these things, and sort of what kind of got you interested in it. That's wonderful. So education
I told my mom whenever I was 9 years old and at a hospital stay at UPMC that I was going to work at UPMC. So that I've also known since I was 9. So whatever way I was going to get here, I was going to be here. So
that's incredible. Well, I'm sure she reminds you of that all the time.
She does. Yeah, absolutely.
So you mentioned that you also have an interest in education, and there's some new things that are happening here related to education and training with optometrists. Tell us a little bit about that.
So since I started at UPMC, part of my interview, I spoke about how important education of fellow optometrists was to me, and how the program I came from, being taught by both ophthalmologists and optometrists, really shaped me into who I am as a provider. And thankfully, Dr. Sahel shared that passion and has been very supportive of me in getting an optometry residency off the ground over the last year. So our first match date will be March 9th, and we're going to have a resident in low vision and ocular disease, as well as a specific ocular disease program, which is similar to the residency that I myself did. And then alongside that, because we're so passionate about teaching, we're going to have the residents involved in teaching of other optometry students. So fourth year optometry students, kind of like fourth year med students that come into our clinic. We're going to have those optometry students be trained by our ophthalmologists, our optometrists, as well as our optometry residents. So we get the optometry residents kind of introduced into academic life and teaching. So those programs will be starting this year. Amazingly, I can't believe it happened so fast, and I'm so thankful.
That's amazing. That is pretty fast, and I'm just so excited to hear about all of this as something new that hasn't happened in the department before. And honestly, you have to say, that it's well overdue. So so now with the with this new direction, and do you see that I understand that the University of Pittsburgh doesn't have an optometry school, but how do you see the university as well as the department really getting getting this organized and getting it structured so the residents have the experience that they need to and then move on to their next challenge?
Absolutely. So we're fortunate to be affiliated with the Pennsylvania College of Optometry. So every optometry residency program needs to be affiliated with an optometry school. And as you said, Pitt does not have an optometry school. So we are affiliated with Salus in Philadelphia. And they've been very helpful in making sure that our curriculum matches what it needs to for the standard of optometry residencies. And, we're with all of the physicians that we work with and, all the subspecialties, we're going to far exceed what we need. So I'm very excited for us.
Wonderful. So tell us just a little bit more about some of the things going on that are exciting in optometry now, and some of the maybe new developments and changes that really will improve patient care, whether it be from the standpoint of, more diagnostic tools, or whether it's better devices or technology even in contact lenses or prescription glasses that are going to be helpful, or low vision for patients.
So I tell patients who, are legally blind or have significant loss of vision, every day I tell them, never give up because you don't know what the future holds. And yes, I can tell you today, maybe I can't get you where you want to be, but 10 years from now, you don't know what's going to happen. I actually encourage all my patients with severe vision loss to sign up for the Eye and Ear Foundation newsletter so that they know if there's ever any research that's going on with their particular disorder or disease, that they are aware of it, on the front line, right there, ready to sign up if they can be involved in clinical trials. From the contact lens standpoint, every year new contacts come out. I often tell my patients, it's kind of like you never know what is going to come out. You never know what lens is going to be available for you next year. Oftentimes people say, I'm fine, my contacts feel great, no issues. Well, what can I do to make them better? If you had to tell me one negative about them, what is the negative? And then we're able to find something even better, even though patients thought they were happy, they didn't know what they're missing. Every year we get a contact lens. This year we got a monthly lens that actually mimics the surface of the cornea. So it repels bacteria, lipid buildup, and patients are able to have lower risk of infections by using that monthly lens versus other monthly lens. And to me, one of the main issues we deal with contact lens is severe corneal ulcers from patients overwearing or patients not cleaning appropriately, not realizing you shouldn't rinse your lenses with tap water. So the technology each year is just astounding. I'm very excited that we're part of all this at UPMC and then what's going on in the eye care world in general.
Yeah, it's, there's so many things and we're always excited, to see these advances and some of these changes in care. And from your perspective, it's great because what you're doing, directly is going to help a patient and it's going to help them today, and obviously that's as soon as the technology is available, I should say, it's going to help them. And I can see that there's so much going on that's going to be there for them in the future. So, this is exciting. This is exciting to hear for the department, but it's also exciting to hear for the patients that are being helped by the Department of Ophthalmology, that we're, not only trying to lead the field in terms of new technologies for people with every type of vision loss, but also that we're really also training the people who will be doing this here and elsewhere throughout the country, and trying to provide them with the best skills and knowledge to be able to help their patients. So thank you for everything that you're doing, and thank you for spending some time with us to share this with us. And look forward to seeing you again.
You too. Thank you.
Okay, take care.